Ethics is a very big subject, and in your MMIs, it's definitely going to be one of the stations that comes up. Pretty much every university tests this because it's such a core part of the degree, and when you start doing medicine, you'll realise that ethics is a massive part of it. But for your level, what exactly do you need to know? Because it's a massive thing. In fact, some universities even offer medical ethics as one-off courses that you can do. So there's so much to learn, but obviously you guys aren't expected to know all of it. So in this video, we're going to be going through what basically this station is going to test of you, and also some key things that are going to help you revise. So hopefully if this is before your MMI, it's going to help you out quite a bit. Let's get straight into it. So before we start, just if you want to know who I am, I'm a third year medical student at Imperial, and I run this channel. I make quite a few videos on med school, basically stuff about how to get into medicine, and also things about like MMIs, BMAT, UCAT. Let's get into today's video, which is all about ethics. Now, what is a station? So in my experience, I've had a few ethics stations at MMIs, and basically the station will test you by giving you a scenario, normally some sort of setting at a hospital, and they'll tell you that something's happened in a hospital and basically ask you how you deal with it. So for example, it could be that a patient of yours is refusing treatment for potentially chronic heart failure, and they'll ask you if this is ethical for you to accept this or if it's not ethical. Now, the key thing about the situation is there is no right or wrong answer. That's the great thing about MMIs. There is literally no right answer, and as long as you basically speak out your thoughts, you'll be good. And that's my first tip, is to think out loud. So in MMI stations for ethics, you must think out loud. The worst thing anyone can do is sit there in silence for 5 minutes because they don't know what to say, or they might have a lot of thoughts but they're just not sure which one to say. If in doubt, just say what you're thinking. It will get you some sort of a mark somewhere. The thing with these stations is that they normally don't have a correct solution. There are normally lots of different things that you can do, as long as you can back up your own answer with any thoughts, and most importantly, also acknowledge that there'll be people who disagree with your point of view and explain why they might be correct. That's all they need you to do. So the basic layout for answering the station is to say, essentially, explain what the station's asking. So in this scenario, explain what the problem is, and explain that there's a patient who needs medication but is refusing it, and explain why that's a problem. Then explain what your point of view is. So maybe you think that's not right and you should give them the treatment anyway. And then also explain the other group of people, the people who think that you should let this man do what he wants to do and not give him medication, and explain why they might be right. Those are the three things that you need to do, and as long as you do that, you're pretty much absolutely fine, and that's all you need to do. Now, some people might be asking, do I need to know any specific ethics? Now, there are a couple of things and concepts and ideas in ethics, medical ethics specifically, that you might want to learn about because they're quite helpful and they can be applied to many of these situations. Things like the Boland principle for confidentiality, and for things like testing patients' competence. Things like the 4 pillars of medical ethics, which I think every medical student should know because it is the easiest concept in medical ethics to use for every station. So please do learn it. You should learn a lot of these principal ethical concepts because they're really helpful and they basically just make your arguments look a lot better. So if you know these principles, you'll look better in the MMI. So please go away and learn them. At least just a few of them, especially the 4 pillars, because you can literally apply that to whatever you want. And finally, looking for resources. There are plenty of resources. The best one, I think, is the Medic Portal. They have basically this massive list of ethical concepts that I just mentioned and more that you can go and learn. They've got breakdown sort of descriptions about each concept. I'm thinking of maybe making some videos on a couple of the harder ones. If this is something that you'd like to see, let me know in the comments so I can make them. There'll be like short 1-minute videos on like each concept, breaking them down and how you can use them. So let me know if you want me to do that. But regardless, this website on the Medic Portal is really helpful, and it basically tells you everything you need to know about medical ethics. So that was a very short snapshot into medical ethics. It's a quick video. I'm trying to make more of these short bite-sized videos because they're easy to digest, and also I can get more of these out more regularly. So hopefully you found this useful. If you did, make sure to share it, subscribe, and I'll see you all in the next video. See you in a bit.